Welcome, everyone. Thank you for joining this session today. Quick housekeeping at the onset of the session. Please feel free to submit questions at your convenience throughout the presentation. Certainly expect to have time at the end of the session to answer your questions. Certainly hope you've had a chance to catch a variety of other sessions so far this week, but in case this is the first one you're attending, please notice the QA button on the right-hand side of your screen. That's the way certainly to get those questions submitted. My name is Chip Sloan. I lead the strategic partnerships team at Home Care Home Base. I've been here for about 4 years now. The focus of this session certainly is speech recognition, but I can almost guarantee that you're going to be amazed, not just with the speech recognition technology, which is certainly remarkable, but with the benefits that customers are realizing through the use of the Envoke technology. I promised that I would show proper respect for our main presenters by not stealing their thunder, but I have to share that I'm at least tempted because it's fun to deliver exciting news. About the Home Care Home Base Envoke relationship, some of you may already be familiar with the rigorous Home Care Home Base partner selection process, so I won't go into great detail here. I will just share that we take pains to seek out solutions that complement our offering in a powerful way, and this Envoke solution definitely fits that bill. As you will see later in the presentation, the interaction between our platforms is seamless. So without further ado, I'd like to introduce the two gentlemen sharing the screen with me. First, we have Jason Banks, who is the Senior Director of Post-Acute Sales at Envoke. And next we have Chad Heiner, the Envoke Vice President of Customer Experience. So Jason, please take it away.
Thank you, Chip. Thank you. Thank you so much. And thank you to all of the participants of this session and to the user group conference, not just for your time and attention today, but for what you all do every day. I had the pleasure of serving on the provider side for a couple of years, and just am so appreciative for each and every one of you. So a little bit of background, one of the things that Envoke is challenged with, or is an opportunity for us, is that, and we hear across the industry, there's a huge clinician shortage, right? So everybody that we engage with when we go to either trade shows or on-site and the providers, we hear a lot about the number one challenge we're having in the industry is our clinician shortage, recruiting, retention, engagement of our wonderful staff. The second thing that we hear is that, the regulatory burden is tremendous. It's great. An example of that is there are 96 conditions of participation for a hospital. There are about 288 for a home health or hospice provider out there. So almost triple the number of conditions of participation on the post-acute care side. And then the third thing that we hear from many of our providers is that they're trying to adapt to value-based care models, whether it's, PMPM, capitated rates, SIP programs, other programs out there. They want to make sure that they're able to participate in those programs because they know that they're able to deliver outstanding outcomes. But the common thread that ties all of these things together is documentation. And so one of the things that Envoke is focused on is partnering with home health and hospice organizations like yours on a journey from typing on their keyboards to a new way to capture the patient's story. And one of the things that we like to say is that, people talk faster than they type, and they speak more accurately than they write. And so I can guarantee with what you'll see today and what you hear that your team will be more efficient using the combined Home Care Home Base platform and Envoke's speech recognition platform than they were before. One of the things that we have the good pleasure of doing is working with customers like Amedisys and Dr. Moss to figure out, different and unique ways to work together. So, we've had a great partnership with Dr. Moss and Amedisys for a number of years now, and that partnership continues to go on. But, one of the things that we found out is that by employing things like a keyboard on the Android devices and single sign-on and real-time narrative capture and recognition of that capture, that we can improve the clinician experience. And so one of the things that Envoke is really good at is partnering with you to figure out what challenges you might be having that we can solve for. Because, one of the things that is interesting as we meet with providers across the country is they think of this as just replacing typing. But what they soon find out is that it has downstream impacts of increasing clinical satisfaction, reducing their write-offs and increasing their speed of reimbursement, and restoring that work-life balance for clinicians. One of the things that we see a lot is that clinicians are still documenting after hours, even though Home Care Home Base is a wonderful platform to be able to get that documentation in on time. And they're still looking for ways to really speed up that documentation process. And one of the things that we hear a lot is that, Jason, we'd love to speed that up, but there's a trade-off, right? The faster we go, the lower the quality. And if we try to get higher quality, it comes at the cost of efficiency. And so what you'll see today is you'll see that we're able to improve upon both factors, not just the efficiency of documentation, but the actual quality of that documentation as well. In addition to Emeticis, we get to work with a number of clients across the country on a daily basis and, demonstrate tangible and meaningful benefits to those organizations across the country. And so I want you to know that we have good experience in doing this over the last couple of years, and we're continued focused on bringing value to you on the provider side with our partnership with Home Care Home Base. Jamie Brown is another excellent client of ours. And, as you'll see during the presentation today, this is very, very simple to use and deploy. What I usually tell people is that it typically takes about 15 minutes to install this onto an Android device and another 20 to 30 minutes to train someone on how to use it. This isn't a heavy lift. It's very simple for a clinician to adopt and operationalize, and for an organization to operationalize as well. And so one of the things that we're focused on is bringing new functionality to that seamless experience. And so one of the examples of that is on the hospice side. We recognized, along with Emeticis and some others, that there is an opportunity to improve the quality of the documentation, specifically around certification of terminal illness on the hospice side. We realized that some of the CTIs and recertification narratives didn't include the proper recipe or ingredients like prognostic statement or disease progression or PPS scale. And so what we did was we're able to batch audit those narratives to figure out what elements may be missing, and in real time tell the doctor as they're doing their voice narrative which of those components of the recipe are missing from that CTI. So for instance, we could say to Dr. Moss, hey, great CTI, but you've forgotten a prognostic statement, or great documentation, but you've forgotten the PPS scale as a part of your CTI or recertification. And so letting the end user know in real time what components may be missing from a narrative note is one of the things that sets us apart from either a commercially available speech recognition program or somebody else, a competitor within the industry. And, one of the things that we found is that, these hospice organizations like yours are spending, sometimes thousands or even millions of dollars in claims denials or rework trying to solve for this particular problem on a daily basis. And so we enable them to be able to solve for that. Just a little bit of background, we operate on two different types of technology. One is our Envoke mobile voice, which operates on the Android tablet. And then, and we do that through a soft keyboard implementation, which Chad will show you today. It's seamless within the Home Care Home Base mobile point care application. And it also enables you to use speech to text with any other application that you may be using on the device. And then we also have Envoke Voice, which is a Windows speech recognition solution. Envoke Voice is Windows desktop and laptop compatible. It also allows you to use speech to text with any application in there, and it does this through a persistent desktop microphone. It is also HIPAA compliant along with our mobile application. And so what we hear a lot from clients, and I was guilty of this when I was on the provider side, is, oh yeah, we just use Android's Google Voice, or we use Alexa, or we use Siri, or we use whatever voice enabled commercial product out there. Couple of issues with that. One, it's not designed for home health or hospice. So what you may find is your end users becoming increasingly frustrated with the lack of accuracy of those speech to text solutions. The other thing, and probably just as important, is that it is not HIPAA compliant, meaning the data is not secured, you don't have access to the data. With our solution, with the Envoke solution, you absolutely do. And it integrates with your point care application as well. So those are all the reasons why we become the leader in speech to text within post-acute care. With that, I will turn it over to Chad, who will walk you through a brief demonstration of the platform.
Patient is a 93-year-old male with a primary hospice diagnosis of end-stage CHF, NYHA class 4, period. Comorbid conditions include hypertension, hyperlipidemia, renal insufficiency, and obesity, period. New line. Patient was reportedly ambulating 40 feet without difficulty 1 month ago, period. Patient is now bedbound 22 out of 24 hours per day due to worsening of dyspnea on exertion and angina with transferring from bed to chair, period. Patient requires assistance with 5 out of 6 ADLs, able to feed self, period. Patient has had a weight loss of 25 pounds over the past 30 days, from 200 to 175 pounds, period. Patient has been eating 25% of 2 meals daily, This has reportedly decreased from 50% 1 month ago, period. PPS 40%, period. Patient and family are aware of the expected outcome of this disease and request comfort measures only, period. New line. All medications reviewed during IDG meeting, period. New line. Prognostic statement.
Fantastic. Every time I see it, I'm impressed by that. I probably am more impressed that Chad's able to talk so quickly, but we do have a collection of submitted questions so far, so thank you. Let's sift through these. I will pick one off the top here. Is there any additional cost from a home care home base to use the Envoke solution? I'll take that one. It's a quick answer, and it's no. So no additional cost from home care home base to use the Envoke solution. Another one here. What does a rollout look like, and what is the implementation timeframe? Chad, could you take that one? It looks like we might have a little bit of audio difficulty. Let me see if I can find another one in chat. I'll come back to you. Here's one. Can we use voice and mobile voice with other applications? And they provided some examples like email, incident reporting systems, APGL, or payroll systems. Jason, could you take that one?
Yeah, sure can, Chip. And thank you for the question. Yes, you actually can use the Envoke either mobile voice application or desktop voice application with other applications like email, like incident reporting applications like APGL, and other applications that you may have on either your mobile device or Windows platform. Remember, it's completely compatible with almost any free text or narrative fields. So you can feel free to leverage the application across the organization. You know, one of the things that we find, for instance, is, there are a number of clients of HCHB that might use a different system for, let's say, certified palliative care. They can absolutely use the Envoke mobile voice and Envoke voice applications for those EHRs as well.
Fantastic. Thank you, Jason. Chad, I'm going to try to come back to you with this question. What does a rollout look like, and what is the implementation timeframe? And still no. So Jason, is that one that you could field?
Yeah. So implementation time frame is normally in the area of 60 days, sometimes shorter, right? Because sometimes what we do ahead of that time frame is we'll do a trial or a pilot with the client. And so a lot of the technical upfront work may have been done by that point. But typically it's no longer than 60 days from start to finish. Not very complicated either. It's just making sure that it's easy to set up in their environment. Sometimes we work with IT on single sign-on or provisioning of the devices, and we want to make sure that we have appropriate communication with all of the end users about the application. It's the Envoke voice application itself, and then we also want to make sure that we're doing the proper train the trainer, because as these your organizations continue to bring on wonderful clinicians into the organization, we want to make sure that you have the capability of rolling this out to them as they come on board.
So another question, Jason, I think you're best suited for this one as well. Does it work with the Samsung phone? The asker is acknowledging that they are no longer using tablets in the field.
Yeah, and that's very common. A lot of organizations are either moving towards phones, or they may be moving from phones to tablets, depending on the organization. It works equally as well on both platforms. So it works on Android phones, it works on Android tablets, just as well as it does on the other.
Okay, fantastic. Sorry, I'm keeping you busy here, Jason. A lot of questions. It's a similar question, I think, that came in two different forms. So hopefully I do it justice to both. But essentially, can we add shortcuts or macros that are maybe organization specific or user specific?
You can. So, and it's all rights driven, right? So, or role based driven, probably very similar to your point care application today, where it's access driven, meaning if you want your end users to be able to create their own shortcuts, they can, depending on their role, or you can set them at a team level, an organizational level, so on and so forth. But the answer is yes, you can create any macros or shortcuts that you want, and those can be enabled either using voice or using the keyboard itself to bring those macros into the narrative note. So the answer is yes.
Fantastic. Gosh, the questions keep piling in. Thank you, audience. Here's another question that I will field, but Jason, please keep me honest if you think I misrepresent. It's a simple question. Is this HIPAA compliant? Yes, it is. And on top of that, I would just reemphasize what Jason called out earlier. One of the biggest differentiators for this solution is its emphasis on home health care and hospice.
Yeah, that's exactly right. We've gone through CHIP, we've gone through SOC 2, which is one of the audit processes that you have to go through to become HIPAA compliant. And we have our SOC 2 certification, meaning we encrypt the data both at rest and in transit, and we go through all of the safety measures associated with being HIPAA compliant.
Okay. Here is another, and Jason, I don't know if you have additional thoughts based on what you presented, but the question is, what has Envoke seen as some of the early ROI metrics associated with leveraging the platform?
Yeah, so, we've seen a lot of documentation efficiencies, and one example, we were working with an HCHB client who as I said, still had some documentation being done after hours. We were able to reduce that documentation time in half for them. Now, it depends on your organization at a provider level. And I always say this to providers, it depends on a couple of different factors, right? It depends on what your end goal is for that time savings, right? And it also depends on, to a lesser extent, how you pay your staff, right? And what I mean by that is we see higher productivity gains in organizations that may be paying per visit or per hour versus salary, and that just goes down to human nature, right? But we also see some impact when it comes to recruiting and retention of clinicians. And so we've seen through things like exit interviews where, clinicians, again, are leaving primarily because of regulatory reasons, right? There's so much documentation required in post-acute, and we're looking to alleviate some of that. And we've seen a 1% to 2% reduction in their turnover rate. So depending on your cost of bringing on a new staff member, we've seen a significant improvement in the ROI of organizations from that perspective as well. And then I would be remiss if I said this doesn't have direct revenue implications as well. Think about all of your clinicians. I'm sure there's a certain percentage that are better at getting their documentation in and on time, and those that struggle with it. And quite frankly, that can impact your reimbursement, not just the timeliness of that documentation, but in hospice case, the quality of that documentation. I talked a little bit during the presentation about CTIs and recertifications. That has a direct impact on the hospice ability to get reimbursed for that care. And so we want to make sure that we're protecting or optimizing that revenue for the organization. And we have seen significant revenue improvements within the organizations that we're employing that technology with.
Fantastic. Thank you, Jason. Here's another question. The fact that the question came in tells me we might need to cover something that you touched on earlier, Jason. The question is the software optimized to recognize medical terminology? So I obviously made the statement how there's an emphasis on home health care and hospice terminology, but could you maybe quickly revisit an answer to that question?
Yeah, so it is specifically geared towards medical terminology, but more importantly, home health and hospice terminology. When you talk about transfers of care and discharge by death, and even things like order sets that you might have in either home health or hospice. We have dictionaries that are built in to the system that specifically reflect home care and hospice. In addition to that, we have a service layer that goes on top of that makes sure that we accommodate for local dictionary terms. What do I mean by that? Local physician names, local referral sources, things that you might not think of being in a common dictionary. We're adding those to the dictionary on a daily basis.
Fantastic. If you will bear with us, there are a bunch of questions. I'm going to take another look here to make sure we didn't miss something. So gosh, I think we're out of questions. If I have overlooked anything, I apologize. I will say if I didn't make it clear at the onset that every question that gets submitted will certainly come back through and review. Anything that we missed, we will provide an answer. We'll post that for everyone to see. If you're like me and you think of any additional questions right after the presentation ends and you didn't catch the contact information, please do reach out to your home care and based client success team, and we'll ensure that you get the answers you seek either directly or put in contact with the Envoke team.
Yeah, I just saw one more chip that I could take and it looks like it came across a couple of different ways, but I want to be able to address it because I see it, I think, twice out there. And is it the platform compatible with those who have a strong accent or dialect? And the answer is yes. While we are not accommodating for other languages, we do accommodate for many different accents and dialects. We work with organizations that have clinicians all across the US. And so we'd be, again, we're willing to trial this with you and make sure that it's applicable to your users and make sure that they're having a great experience.
Hello, everybody. Gotta love technology these days, right? When it works, and when it doesn't, it doesn't. But great to rejoin. You're exactly right, Jason. In terms of accents, the beauty of a cloud-based solution is that you get to leverage the technology at the highest level, and we have been able to incorporate a very wide range of accents. We know that many home healthcare workers, English is their second language. We absolutely support that, and all the regional dialects as well.
Chad, I also saw another question on here about what types of microphones are compatible with the platform as well.
Yeah, great question. So with the mobile device, the built-in Samsung microphone works fantastic. It has noise canceling properties and really provides good fidelity for speech recognition. On the desktop, we support a whole wide range of microphones. We prefer USB connected, so that can come in the form of a handheld microphone or a boom mic, something that allows for a wideband audio connection, but a whole variety of them.
Awesome. And I see a couple of questions around just, how do we get pricing on it? I would say work with your home care home base account manager. Chip, I don't know if that's the right phrase to use, but they're a wonderful team. We've gotten to meet many of them and sort of educate them on this, and they will direct you to us, and we'll go through the process of providing you with pricing. You'll find that it's very economically affordable. It's I often say it's less than a cup of coffee per day, and maybe a Dunkin' Donuts cup of coffee, maybe not a Starbucks cup of coffee, but a cup of coffee nonetheless. So I'd say work with your account managers to get in touch with us, and we will provide you with that pricing. Absolutely.
Fantastic. Yeah, client success team is the term that should be familiar to this audience.
Awesome.
So, gosh, on behalf of Jason and Chad, want to sincerely thank you for attending the session. Very much appreciate all the questions. Like I said, in the event that we missed any, we'll certainly make sure we provide those answers after this session once we post all the information. So I understand your time is valuable. We certainly appreciate you joining. So
thank you, everybody.
Goodbye, everyone.